we have to keep at it. It takes all of us, right? It takes a village.
Yeah.
There is not one single person in this country who cannot be an advocate for gun violence prevention. And again, not a political issue, whether you're a Republican, Democrat, right? These are things that you probably want. You probably want to keep your kids safe. You probably want less violence. You want safer public spaces. That is stuff that we have to get educated about, and in our different domains of work, continue to spread that dialogue, amplify that dialogue, not vilify people, empathize with folks on both sides of the debate, and then really work with lawmakers to get them to understand what we're talking about. This is not a black or white, Republican versus Democrat issue. This is a everybody issue, and I think that's the responsibility of everyone on this call, everyone on this
Yeah.
podcast who's listening.
Mr. Rathod's neighborhood. Wow, come on. It's Mr. Rathod's neighborhood. He wants you to meet his friends. It's Mr. Rathod's neighborhood. Have a ball now, y'all. It's Mr. Rathod's neighborhood. Just might learn something. It's Mr. Rathod's neighborhood. Yes, you. It's Mr. Rathod's neighborhood. It's time to enjoy the show.
Okay, cool. So maybe, you ready to? Forgot my.
Yeah, let's do it.
Water. Okay. Yeah, you ready to get a crack in though?
Yeah.
Cool. Okay. Hey, buddy, how's it going?
Just like me and you talking. Great, man.
Yeah.
Good to see you.
You too. You too.
Good to see you. Yeah.
Thanks, man. Good to see me too, and good to see you as well. Okay, so let's introduce you, or I'll have you introduce yourself, and talk a little bit about some of the, your background, and then we can dive into the good stuff.
Awesome. Yeah. Well, first and foremost, I'm one of your friends, for a long time now, and we've had, too many memories to count, and it's definitely been an amazing experience in my life to meet you and have these conversations with you. So I also hope that this is one of many. Professionally, I'm a pediatric surgeon. I'm our trauma director, and I also direct our gun violence prevention center here at Northwell Health, which is the largest health system in New York.
Cool. Yeah, and so that's why I wanted to have you on, was to talk about that space. You, more than anyone I know, has been sort of involved in that world. I think we all have our thoughts and feelings that are a combination of personal feelings and what media is telling us and everything. And there's so much going on in the space of guns and gun violence. So that's, I'm really, really excited to have you on. And actually, you were in town a couple of months ago, and I met some of your colleagues and some of the people you're working with. And so I got to learn a little bit more about different individuals in that space. So maybe let's start with what your role is, or what your organization is doing within gun violence prevention, or what you're trying to uncover, I guess.
Absolutely. And, I'll start a little bit with, a little bit of backstory, right? For me, it's not that I planned to focus on the topic of gun violence prevention as part of my career. I trained to be a pediatric surgeon, operate on kids and babies, and this was not part of the plan. But it really came to be after my experiences here in the US. And just for background, as you know, I'm Canadian, trained mostly in Canada, Toronto, and then came to Chicago Northwestern to do my pediatric surgery fellowship. And that's really where I first had to experience treating these babies with bullet wounds. And it was just absolutely horrific. I mean, for most people, it's just not something that you ever imagine seeing. And after you see that and see what the parents have to go through, you ask yourself, how can you not make something like gun violence prevention one of your main topics of advocacy and doing something about it? And, that was not the last experience in Chicago. We've had to see kids week after week in Chicago and here in New York with gun injuries, and this is absolutely a preventable disease. So really the point of what we're doing at Northwell is to bring hospitals together, bring the healthcare industry together, to depolarize this topic, destigmatize it, and approach it from a public health lens. If you look at the way that we tackle things like the opioid epidemic, COVID-19, tobacco back in the day, or car safety, it was data, public health, and healthcare that really moved us forward in tackling those epidemics. And we really need to do the same thing when it comes to gun violence. So the main purpose of our center is to really educate folks, research what interventions work and don't work, and implement those interventions to really help move the needle on this epidemic and bring those gun violence deaths across the country down.
You use the word disease, which is so interesting. I genuinely think that's the first time I've heard that word used in the context of this. And is that does it change the way that we look at it when you like define it as a disease versus like almost like, you know, I would say that as an outsider, it's like just kind of sounds like random things that are happening or a problem, but not a disease that we could diagnose and find what's causing it, solutions to it, and all that. So that's an interesting word.
Yeah. Yeah. No, it's absolutely a disease. It's an epidemic. It's a public health issue. There are many people who, when you have this conversation initially, and things change as you have the conversation, people will start to see the light, but they'll say, no, this is a political issue. And, what I say is, how can this not be a healthcare issue or a disease issue since it's killing so many people? Right? I mean, firearms are the leading cause of death among kids in this country. So the most likely reason that your child will die in America is because of a firearm. That has to be a healthcare issue. That has to be a disease. And yes, there is a way to contextualize this around disease processes, looking at an agent, a vector, a host. There are robust ways to look at public health strategies to tackle this that are apolitical, that don't have anything to do with the Second Amendment. We can create safer societies. And so, happy to dig deeper into that. But yeah, there are a number of different ways to view this from a public health lens that have nothing to do with politics. Because I can tell you, Shirag, I mean, after having spoken to Americans across the country, right, day in, day out on this topic, on the right, left, center, you name it, everybody wants the same thing. I have not met an American that does not want the same thing. They want safer communities. They want no public mass shootings at schools. They want limited violence, and they want to keep their kids safe. And that is actually what centers most of the approaches to curb gun violence from a public health lens that we're going to talk about today. And it's that common ground that we need to find.
Yeah, the political stuff really makes things so muddy because it kind of like blurs what the reality of what most people want, which is just like to not their communities to be safe, like, and their families to be safe. There was a stat, and I probably need you to correct this stat for me because I'm sort of I'm not fully remembering it, but one of your colleagues told me something like, so you said the number one and correct this rate, the number one risk of death in children is guns violence, or like being shot. Okay, so that's one. The second she said was it was like 60% of gun violence happens in the home, or like some high proportion of gun violence happens in the home, between family members or whatever, and then I'm forgetting the rest of it, but there was like a small percentage that came from like mass shootings in schools. And what it got me thinking about is all we hear in the news is like, oh, there's suicide. Sorry, a high proportion is like suicide death by gun. And then another one is like in the house. And so that's like a majority of gun deaths, correct?
Yeah, exactly.
And so, and obviously this isn't
if you bucket that with suicide, yes. And I can walk through the stats for sure.
Yeah, please. And maybe clarify the stats. I can tell you what it got me thinking about when she told me that.
Yeah, well, happy to. And why don't you tell me what it got you thinking about, and then I'll break it up.
So all you kind of hear in the news is like they talk about mass shootings, and it's like a primary, like guns are bad because of this, which creates this political landscape of I love guns, that's not the problem. I hate guns, that is the problem. And it blurs what the higher proportion is, to not say obviously like, mass shootings are not, those are horrendous and horrifying, but like it almost is like there's a different conversation that actually should be had about safety prevention because of what is like 80% or whatever, some high proportion of like what the actual a large majority of the problem is. And like it's blurring what actual solutions are. It's blurring an actual healthy conversation.
Totally.
It's just like all jacked up, and it's got us thinking about this one element, which is horrifying and also needs to be corrected, and is missing this gigantic where there's an actual opportunity for a healthy conversation that can be like, we're all on the same page, man. Like we're being pitted against each other in this area here, when there's this larger thing that can create like a collaborative, more honest approach to addressing something.
Yeah, I think, that's why I wanted to hear where you're going with that, because I could not agree more with you about the blurred lines. And I think what you're pointing out is that nuance is key, right? With further education, you start to get into the nuance of this topic. And what I mean by that is gun violence as a whole really means any type of firearm injury related death, or just injury, non-fatal firearm injury. And that could be suicides, that could be unintentional or so-called accidental injuries, where kids play with guns in a household that is not, where those guns are not secured safely and they accidentally shoot somebody, or it could be homicides. And in the homicide bucket, you have assaults, you have what we call community interpersonal violence, and then you have a small sliver that includes public mass shootings, like the ones at schools that you're talking about, that do account for roughly less than 1% of all gun violence in this country. But just think about how different each of those types of gun injury is, right? Solutions that are going to prevent a firearm suicide are not necessarily going to do much to prevent community violence. Just like solutions that tackle community violence, which might need to be more focused on social determinants of health, health inequity, structural racism, food security, economic mobility, are probably not going to do that much to stop a public mass shooting, right? Where you might want to focus more on things like assault weapon bans, universal background checks, crisis resources. So yeah, that nuance is so important, and you're absolutely right. Very few folks in the media and in our conversations at large ever point that out. And I think that's actually one of the reasons why we have a personal mission to continue to harp on that nuance, but it's one of the reasons why this has become such a polarized topic. Because what you do there is you naturally vilify certain groups. You're absolutely right. You make, a legal gun owner feel as though they're being targeted to be responsible, let's say, for interpersonal violence in another community. And that's not really, or should not be, the focus of the conversation, right? When probably people from different communities want the same thing, to my point earlier. So yeah, it is that nuance that's incredibly important. And for stats wise, yeah, roughly 50,000 Americans are killed every year. Around 100,000 are non-fatally injured. 6 in 10 gun deaths are suicide. And I will say the upticks that we're seeing in recent years for gun violence, especially in kids, are largely driven by homicides. So it's only a matter of time where I think homicides are going to come above suicides. But yes, it's a very diverse epidemic.
Yeah, and it's so interesting, yeah, because a solution for community solutions are so potentially different than like interpersonal or individual like solutions for people. Is your group then focused on sort of one, like trying to reframe the conversation about how do you even classify gun violence first, and then you can start to yeah
a lot of our work is focused on public awareness and education and changing the dialogue. So reframing it as a public health issue absolutely requires this level of nuance, right? Otherwise, people are not going to understand. And though this is not a political issue, at the end of the day, a lot of the policies that we talk about implementing, they're not political. They're just policies that are needed as part of good public health. I mean, we don't view seatbelts as political anymore. We don't view age limits on smoking, tobacco buying as political anymore. They were viewed as political at one time. So it's really reframing those in the context of a public health crisis.
And so that's what they did. So seatbelts used to be a political like thing, and then they just said
absolutely. Oh yeah, the automobile industry did not want to implement safety measures, right? I mean, these are all increased costs. Even the rear view cameras that you see in cars today, advocates, one of which I know very well, actually had to fight tooth and nail to get those implemented into cars. It was not the car industry that just went ahead and implemented those. But over time, now you've definitely seen that from a brand standpoint for cars, people like safe cars. And, consumers have pushed the idea of safe cars now. But it was those regulations and policies that started the journey.
What was the pushback? Sorry, go ahead.
Well, I mean, first and foremost, there was a lack of data showing that cars were unsafe. And the CDC pushed to get better data on fatalities related to road injuries. And that's actually what led to a lot of this regulation from coming in. But the pushback from industry is always going to be, well, it's not needed. You have no evidence. It's not really going to save a life. And it's increased costs for us in the background, right? Like they're not going to want to do things that are increasing costs for them or that they might perceive as cumbersome for the consumer. So, there was a time where, right, like, people don't want to wear seatbelts. They want to just get in their car and drive. People want to be free at whatever age to buy tobacco, right? But those mentalities were shifted, right? Even if you look at the smoke-free zones, right, there was significant backlash at the idea that restaurants, certain public spaces would be smoke-free. Now think about it, right? This is just accepted. So that's where we need to get to when it comes to guns. We have a long way to go, but we're definitely starting that journey.
Yeah.
And the one unique thing though about guns is that the gun industry is protected by a law called PLACA that prevents them from being held liable for the use of their products. That's the one difference that I think significantly hampers our ability to hold that industry responsible, because things like smart guns do exist, for example, and they could actually stop a lot of the things that we're talking about, but they're not integrated or part of the gun industry's plan because they're not implored to do so yet.
What is a smart gun?
And because legally they're not required to do, right? Like if you can't sue, as you know, if you're, look at the Sandy Hook parents, they tried to sue Remington settled, but they didn't actually win the lawsuit. You know, if you can't hold industry responsible for the use of their products, they're never going to necessarily on their own want to make them safer. Why would they want to do that? And to your point, a smart gun is like, for example, a biometric gun, one that can only be activated with your fingerprint or your eye. This would stop things like mass shootings, right? A lot of kids get their guns from parents unknowingly and use that for a mass shooting. This would stop potentially accidental injuries where kids are playing with guns and they shoot each other. It would stop interpersonal violence, where a lot of illegal guns started off as legal guns and were meant for one user and went to someone else. So it would stop a whole host of issues, and those have been around for some time, but you don't see them anywhere being used in the mass public.
Yeah. Man, you know, it's interesting as you were talking about like holding companies liable. It's kind of got me thinking a little bit about some, I guess it's not the same, but some of the pharmaceutical like stuff that's been happening with the opioid epidemic,
Absolutely.
pharmaceutical companies and companies being able to kind of just like, you know, sort of be like, my bad. And then, you know, now I guess they're having to give money to communities, but like, yeah, it just, I don't know if that same protection exists for pharmaceutical. I don't know if you know that, if it's this, those
no. So that's exactly, and opioid, you know, that's a great example, right? We watched that documentary. I'm sure many of us have, and forget what it was called on HBO there, around the marketing practices of the opioid industry and how they worked with physicians to overprescribe, and how, you know, where the responsibility lies with respect to the opioid epidemic that we have. And yeah, it was through liability. There is no protection there. That is actually what has led to a number of restrictions, not restrictions, regulations and policies in the name of public health to help save lives and so on. So the gun industry is the only industry in the entire country that's protected this way. There is no other industry that has this law that protects them.
And what's the law called again? What did you say it was?
It's called PLACA.
PLACA.
It stands for, tell you, I always forget the one L. Yeah, so it stands for the Protection of Lawful Commerce in Arms Act. So the act is directly targeted just to protect the gun industry.
Yeah.
That's all that law has to do with.
And do you know what their, yeah, what was their, I mean, I'm just trying to wonder what their reason was for making the law. Was it like, we know these things are dangerous and there's going to be bad stuff that happens and we don't want to get in trouble when someone uses our product to do something bad, so
exactly,
we need a lot of
protect ourselves. And because they have a significant lobby, and they're significant funders of a number of our federal lawmakers and state legislators, right? So I mean, they've, you know, the NRA and others have been a significant lobby. They were able to get that type of law put into place to protect their products, which is fascinating, right?
Yeah. What I don't understand is why is the conversation about suicide deaths by gun and like stuff at the home, why is that kind of lost in this? Why is that not the, like, also there with the like community violence and like mass shooting? Why are we not also talking about that? What is the, like, why did media not choose to harp on that? Why do like politicians, or, you know, and I mean, I sort of know why politicians bring up things and don't bring things, you know, it's all based on whatever, how they're funded and, you know, their audience that they're talking to. But like, it really genuinely, like, when I'm hearing it again, it's like crazy to me that like that isn't, I mean, we're just not there yet. I just don't understand why we aren't talking about that more as a like primary thing to look at.
Yeah. I mean, when it comes to suicide, no, absolutely. I mean, simple access to a firearm right? Significantly increases the risk of suicide and homicide in a household. And we know that if you have a firearm, you're much more likely to complete that suicide, right? Because most of these injuries from guns, particularly to the head, are lethal. There's nothing that can be done. Versus if you look at other countries, even Canada included, that have similar rates of suicidality or even higher rates of depression, the suicide rate is actually lower because they just don't have access to these lethal means. They might use a knife, they might use a medication, but they're likely to be less successful in that suicide because those lethal means are not as lethal. And as a result, we know also that in many cases, these suicide attempts are just a one-off. That's the sad part, right? It's not like, these individuals are going to be trying to commit suicide over and over again. These are often a one-off scenario. So many of those folks who don't have access to a firearm in other countries, they don't kill themselves. They actually never try again. And that's lives saved, right? So simple things like firearm suicide prevention are possible. That includes behavioral health treatment as well, for sure. But there's also a significant firearm component there as well.
Interesting.
And then to your point about community violence, yeah, I mean, there's tons of bipartisan support for tackling community violence. That has to do with addressing the underlying risk factors that I mentioned earlier. But a lot of that gets lost in this conversation around assault weapon bans, background checks, highly political laws that, yes, would make a difference, but aren't the be end and end all. And arguably, there are other policies that we're talking about right now that can make a bigger impact on the overall epidemic.
Yeah. I know you said you might have to cut it. I want to give you a chance if you wanted to. One, we can keep going. I want to keep talking about this. We can also park it to another time. You tell me where your time's at.
Yeah. Why don't you just like 3 more minutes?
Yeah, of course.
Sure.
Okay, well then let's
yeah. You can bring in like another question and then think about wrapping it. Whatever you want.
Yeah, sure. I mean, I guess one is like, what are you seeing that's being done based on your work? What is some of the like positive changes that you've been seeing, sort of like maybe in the way that they talk about it politically, or some of the stuff that you guys are working on, or stuff that communities are doing, and then also just any kind of like, maybe what you guys are going to continue to be working on in the future over the next 2024 and beyond.
Yeah. So I think, for the latter question there, we're working on a ton of different things, research, we're working closely with the White House on a number of initiatives. There is many different verticals we could talk about. I think that, we should park that for a different conversation. But to your former question, I would say I definitely have a lot of hope. I think over the last 3 to 4 years, I've seen a huge momentum shift in wanting to tackle this as a public health issue. We've seen hundreds of millions of dollars poured into not only policies that we mentioned before, but support of community violence intervention organizations who do great work in this space and help stop cycles of violence, particularly in Chicago, for example. Some great stuff has come out of that. We've seen millions of dollars being put into safe storage campaigns. Crisis resources for those who are in crisis, the support of things like red flag laws, which for those listening who don't know about them, they're laws that you as a family member can actually enact quite easily to temporarily restrict a weapon from a loved one who might be at risk of harm to self or others with a firearm. So temporarily restrict a firearm. And that has been shown to significantly save lives. You can stop a mass shooting, you can stop a suicide, you can stop a homicide. And so you're seeing hundreds of millions of dollars poured into that. As you know, a year and a half ago, we had the Bipartisan Safer Communities Act that was passed, and that was the first bipartisan gun legislation in 30 years. So I think, these are all signs of tremendous momentum. I definitely see and work with a number of survivors in this space. They also see that momentum. They feel more and more supported. There's a lot more to do. And then in the academic space, since 2019, the federal ban on gun violence research was lifted. We now have millions of dollars available for gun violence research. So absolutely, we've seen a huge uptick in the number of research publications in this space. What do we mean by a public health approach? How do we get the data that we need to solve this crisis? It is only in the last 4 or 5 years that that's actually come to be. And so that all gives me tremendous optimism. And honestly, it's everyday conversations like this with Americans across the country where you start to realize we have more common ground than differences. That's honestly what tends to give the most hope.
Yeah. That's amazing. I mean, it sounds like we're pretty early on in the stage of even research of that ban just recently lifted. Like we're at kind of the sort of infancy of just really beginning to like truly dive into, as you said, like as a disease, to understand kind of the everything about this to be able to create some like realistic solutions in this country, which is pretty incredible.
Could not agree more. Could not agree. And we have to keep at it. You know, it takes all of us, right? It takes a village.
Yeah.
There's not one single person in this country who cannot be an advocate for gun violence prevention. And again, not a political issue, whether you're Republican, Democrat, right? These are things that you probably want. You probably want to keep your kids safe. You know, you probably want less violence. You know, you want safer public spaces. That is stuff that we have to get educated about, and in our different domains of work, continue to spread that dialogue, amplify that dialogue, not vilify people, empathize with folks on both sides of the debate, and then really work with lawmakers to get them to understand what we're talking about. This is not a black or white, Republican versus Democrat issue. This is a everybody issue, and I think that's the responsibility of everyone on this call, everyone on this podcast who's listening.
Yeah. Well, look, thank you so much for being on. I really hope we can like have more of these to dive, you know, a little bit, or not even a little bit, just dive deeper into all this and, you know, continue to update folks on sort of what you're doing. But maybe to close, like, where can people either follow you on social media, learn about your group, you know, websites, all that stuff, anything you want to shout out that people should look into about yourself and the organization?
Absolutely. Yeah. So, you know, you can reach out anytime on LinkedIn, Dr. Chethan Sathya, or Twitter at Dr. Chethan Sathya. A message me anytime if you want more information. And if you Google Northwell Health Center for Gun Violence Prevention, you have a number of great resources. If you're in healthcare, we have a collaborative that you can join. You can learn more about the topic. And if you're not, if you're a parent, we have resources up there for how to have this conversation. For example, how do you ask about the safe storage of a firearm when you send your kid over to someone else's house? That's a big part of our push as well, is safe storage counseling. So, you know, we ask as parents about drowning avoidance, safety gates when we send our kids over to someone's house, but why don't we ask about the safe storage of a firearm if a firearm exists in that household? Because remember, over 6 million kids live in households with guns that are unsecured. So it is a high probability that that could happen. And I think that's how you normalize this conversation. So we have all kinds of resources on the website if you Google that, and you know, hopefully you can find that useful.
Cool. And also put links to all of that stuff, like when I post this episode. But thank you so much, man. I really appreciate all the work you're doing. I really appreciate you being on. This has been a long time coming. And but yeah, thank you so much, man. Thank you so much for everything.
Thank you, Chirag. Wonderful to talk. Looking forward to more.
For sure.